The wildlife program that we have here at the University of Georgia is very good, not only for the students as well as for the animals that come in, that we try to take to a state of rehabilitation, and from there these animals go to a rehabilitator and then from there get released. Ultimately that's their goal. It's okay, you can bite me, it's fine, it's fine, you can bite me.
Our residents are usually the ones with the scalpel blade, while I am right there with the forceps, and I kind of assist from a cutting point of view, but I do make sure that everything is cut the proper way and everything is done the proper way. So it's a way for the residents to get their first exposure or second or third exposure to surgery cases, while I'm still there to mainly oversee the procedure and also calm the nerves.
So as the students come in, like freshmen and sophomores, it's really a big help for them to come down into the clinic and get a lot of experience down here. So it makes it easier on us, and especially me as a technician working with students, to have them have that experience and know where they're going and what they're doing in the hospital, how to handle a bird or an animal or possible rabid animal that might be, you know, sent in from wildlife. It helps for them to have that experience so that they're not kind of thrown into it not knowing anything.
This is pretty much the only truly hands-on clinical experience that students can get before they enter clinics. You can do the small animal treatment crew or large animal treatment crew, but that's not as much of a clinical experience as we would like, primarily because those are clients that pay, and so there are a lot of liability issues. With wildlife, there aren't clients that pay, and so we can actually have students making clinical decisions, diagnoses, doing clinical tests, and deciding on what's appropriate for each patient, which is something that as a veterinarian, that's what you're going to be doing every single day. And this is the only opportunity you have before you go to clinics to do something like that.
All the students who pick our rotation are genuinely interested in it. A lot of times people are worried about it, that this is very difficult, very odd kind of medicine, but to be honest, it's not that different. It's the same thing, it's a little bit different how you approach it, but your basic medical knowledge still is being applied as it would be a dog and cat.
Okay, well pretty much what all the students do with Wildlife Treatment Crew is they'll receive the patients first and do their own physical exam, and then kind of compare their physical exam findings with the physical exam findings of the doctor, and then they kind of formulate with the doctor a treatment plan.
You're probably looking in the area of between $100 and $300 per patient, and that's because the hospital gives us a really wonderful discount. But it can't be done for free, obviously. So Wildlife Treatment Crew is funded in part by tuition money because it is a class. We do get class credit for it. So it's funded in part by tuition money. It's funded in part by the hospital. The hospital gives us some, and the hospital also partially matches donations, but a huge part of the way we're funded is through charitable donations from people who bring in wildlife and people who just want to give donations. It can be difficult to see wildlife come in that's severely injured, but at the same time, that's why we got into this profession and why we got into the Wildlife Treatment Crew. We want to be able to help, and we also want to learn how to become doctors, and that's a lot of what those animals do for us.